Hi there, I am here at Spainhauer Wellness Center with Dr. Gary Spainhauer, and today we're going to talk about neuropathy. But before we get going, Dr. Gary, will you please tell us a little bit about your background?
Absolutely. Yeah, this is my 39th year of practice. I got into chiropractic for a bunch of reasons, but early on I was very interested in nutrition, clinical nutrition, and sports injuries. I had a few injuries myself. I was a weekend warrior, played a lot of sports, and I love treating the athlete. So I became a certified chiropractic sports specialist. So it teaches you ways to treat everything from extremity injuries and back injuries. And over the years, I've treated numerous professional athletes, weekend warriors, ultra marathoners. I had a patient that was a world-class climber and Mr. Olympic, the guy competing for that, professional football and baseball players. But most of my practice is the person that goes out, hurts their knee or their back or their neck with normal activities. And we utilize what works best on the pro athlete, works best on the average patient.
Awesome. So do you want to tell us a little bit about what neuropathy is?
Yes, neuropathy is interesting. It's characterized by long-term discomfort, pain, tingling, numbness. It's usually in the lower extremity. It can be burning, and as time goes on, it can be progressive and very, very painful. Early on, it's painful, usually more at night, but often later on, it's very difficult to even walk.
Mm-hmm.
So neuropathy can be caused by a host of things. A lot of us know about diabetic neuropathy, and that would be one source. There's also chemo-induced. We've had patients that have had chemotherapy that created the neuropathy, and then there's autoimmune disorders. So all of those can often benefit from the type of approach we use here at Spainhauer Wellness.
Awesome. A quick question. Age range of people who normally deal with this, is this specific to an age?
Generally in the 40s and 50s, and probably more often in the 50s and above.
Okay.
It can occur earlier, but especially if it's chemo-induced, but 50s and 60s, people have neuropathy.
So what are the general symptoms that you see with neuropathy? What, like from the beginning, or if somebody's already had it for a long time, at the end?
Yeah, in the beginning, it can start with burning and aching. And then over time, you could have burning, aching, you could have electrical sensations. It could be so bad that even pulling a sheet over the feet at night can be painful.
Okay.
So pain, burning, numbness, and tingling is the general symptoms.
What body parts normally get affected from this?
Obviously, it could affect the upper extremity, but not as often. Probably 95% are lower extremity, the bottom of the foot, the feet, and then later it can progress where your whole leg's ache.
Okay. So what do you do to help people through that?
Usually patients that end up here have tried everything. The traditional approach is to try things like Neurontin, gabapentin, medications that are designed to help a bit in the beginning, but usually over time they're not very effective. And generally it kind of takes the edge off, but the patient, over the months and years, things get worse. So we'd like to see them early. It's much easier to deal with, but we usually see them later down the line.
So people who normally come here have already been to their family doctor and they've tried all these pain meds, nothing's working, and somebody lets them know, hey, a chiropractor wellness center can probably help, and then you take them in and do what?
Our approach is combining certain clinical nutrition supplements that will help with the body's ability to adapt to this. We also, one of the most effective things is laser therapy.
Okay.
And laser actually creates a metabolic activity where we focus that laser. So it increases the metabolic rate, the rate of tissue activity, if you will.
Okay.
It helps a nerve that is highly inflamed, can help it heal. A nerve that's hyper-functioning, and the laser will bring that down to normal function, or hypo-functioning. That nerve isn't firing as well. So we generally treat, in the case of the lower extremity, the foot, the feet, and then the low back where the nerve exits the spinal cord. We'll also, depending on the problems, often you'll see some low back issues related. Once a nerve in the low back is being irritated, it is far more vulnerable along that nerve all the way to the bottom of the feet.
Right.
So depending on the needs there, we have decompression, we have chiropractic adjustments, depending on the needs of the patient.
How long does it take for somebody to come in, go through your program and say, I'm feeling way better?
So neuropathy, again, is a challenge. Our rule of thumb, 4 weeks of treatment, both of us, the patient and myself, will know they're making progress. Some can make quite good progress. Occasionally, unfortunately, with advanced neuropathy, there's not much progress. So then at the end of 4 weeks, we've done our best. As long as the patient has done their work, we've done our work. There's a percentage, because this is a difficult disorder, that don't respond. The good news is, the goal for advanced long-term neuropathy is if I can get rid of 50% of your symptoms, your quality of life goes way up. And some will be better than that, but that's the baseline goal. Now, if you had neuropathy for 2 months, the chance of me helping you are far greater.
Right.
That's when I'd like to see people.
Right. So get in early. If you're having pain, don't wait. Don't pop a couple Advil. Get in and see Dr. Gary Spainhauer. So I have another question for you. I hear about feet a lot, but when you're saying upper extremities, like specifically, where do people feel?
Again, the neuropathy we're discussing here today is not that often in the upper extremity, but it could be in the hands.
Okay.
The neuropathy in the upper extremity is often from a cervical disc, a pinched nerve of the neck.
Right.
It's usually not diabetic neuropathy. It's usually not the chemo-induced, but it could be, and I have seen that.
Can you explain to everyone what diabetic neuropathy is?
Yeah, basically when your blood sugar is high, you have tissue destruction. You have damage to nerves, you've heard of blindness, ocular degeneration, those kinds of things that come from diabetes. So the nerve is getting too much blood sugar, and elevated blood sugar is toxic. It makes your nerves sick, it makes your body sick. And so that's kind of the nutshell of what's going on with that.
Okay. So what I'm hearing you say is there's nutrition component.
Yes.
Use the laser and adjustments, and give it a good 4-week go and stick to it.
And the odds are good. I will tell you my percentage of estimate of what we think we can do. There's also some homework to do. There's a whole series of things. We have a protocol that can be quite effective. And with diabetics, if people are interested in really looking at a nutritional approach, a little different than you may have gotten from your nutritionist, that's my wheelhouse. What can you eat? Are you doing all the right things? Is there some things you heard were good and they're not so good?
Yeah.
Or that heard you didn't know that you could eat more of a particular thing? And then there's timing of diet. How often you eat is a bigger component than you know.
Oh, absolutely. Awesome. Well, that is super helpful. If anybody has any questions, if you feel like maybe you have neuropathy, throw some questions in the comments, what maybe some of your symptoms are. Dr. Gary Spainhauer will go in there and answer those questions, and hopefully this is helpful, because I know a lot of times we have pain and we wait.
Yeah.
We don't think about it. Like, it'll go away. Maybe I twisted my ankle, and then you find out you've got something that's going to take even longer. So thank you so much. That's incredibly helpful.
My pleasure.
All right, you guys, stay healthy, and until next time, we'll see you later. Thank you.